we want to get the team up here?
Yep.
We got everybody here?
No,
Who are we
need
missing to?
Chris and Dr. Cook. Come on
Yeah,
up.
come on, you
Yep.
guys. Come on, draw near here. Good afternoon. I'm Governor Jay Inslee, Governor of the state of Washington. We're here today to give a briefing to the public regarding the novel coronavirus that has recently been identified in a Washington state resident. I'll give you some just basic information about the situation, and we have a host of scientific and medical personnel that will talk about our multi-tiered response to this particular concern. Just specific dates from November to January 15th, we had a Washington state resident, a man in his 30s, who was in Wuhan, China. On January 15th, he returned through SeaTac to his residence here in Washington state. He fell ill on January 16th and went to be evaluated for his condition on January 19th at his local clinician. At that time, it was suggested to him that he remain in isolation at home so he would not be a potentially transmitter of any particular disease. He was then, on January 20th, samples were confirmed by the CDC in Atlanta that, in fact, he carried the novel coronavirus. And he was hospitalized, and we're very happy to say that he is in satisfactory condition. And as of this moment is very helpful in us identifying particular people that he may have been in contact with. We think this has been a very rapid response. We want to express our appreciation for the CDC, for King County Health and our state health department. We think that they have demonstrated a really good working relationship in having a multi-tiered, multi-level response to this particular concern. And so far it has been extremely quick, from a Sunday designation of illness and next day have it identified. We're pleased for the ability of the scientists to be able to identify this particular disease. General, if I can just say at this moment, as Governor of the state of Washington, the good news is the CDC, and we also agree that the risk is low to residents of the state of Washington. And this is certainly not a moment for panic or high anxiety. It is a moment for vigilance, and we are pleased to report that we have a very comprehensive approach that is acting very quickly to respond to this, to identify the potential folks who may be subject to transmission, and also obviously care for the individual who's involved to date. And if I can just talk about this for a moment. The good news is our local and state health departments have been prepared for this for some time. They have drilled on a response in this regard. And the local Snohomish County, health department has been working closely both with our state Department of Health and the national CDC in a response to this challenge. The approach that is now being taken, we have been in close contact with CDC to try to prevent additional folks from coming who otherwise would not know about their infection capability from China. So what is happening is that the teams have employed a multi-leveled approach in that regard. We're pleased that the CDC has adopted a policy of essentially having only 5 airports in the United States who will receive visitors on direct flights from China or in linked flights from China. And those folks will be subject to a screening protocol that the CDC will be responsible for. So at SeaTac, there will not be folks visiting from China who will fly directly or even on a connecting flight that do not go through those 5 airports. So the people who fly into the state of Washington in the immediate future will be needing to go through the 5 airports where they have some additional screening that the CDC will be responsible for, and we're confident in their abilities to work in that regard. As far as what Washingtonians should do or not do, I'm going to let John Weisman talk this about in detail, but I think the important thing to know is that there isn't a risk level that would suggest people should be doing anything differently than they normally would. Like I said, this is not a moment of high anxiety. we should all do exactly what we always do, which is, this is flu season, so we wash our hands, we cover our mouths when we sneeze, and when we are ill, we stay home from work so we don't expose other people to infection. We just think people should continue that. We do not believe this is something that should interfere with people's daily lives or even a position of anxiety in this regard. However, we take this very seriously, as we have in previous infection cases, where the protocols that we have adopted have been largely successful, and I'm pleased to see them acting very quickly today in that regard. And we will continue in that vein. So with that, I want to turn it over to John Weisman, who is one of the players, and I should reiterate this. This is a team of multi-jurisdictions. I'm glad to see it operating, and we'll turn this over to John.
Great. Thank you, Governor Inslee. Hello, and thank you everyone for joining us here today. As the governor said, I'm John Weisman, Secretary of Health for the state of Washington. As you know, today, Washington State and Snohomish Health District officials, along with CDC, announced the first U.S. case of a 2019 novel coronavirus. I first want to start by recognizing the quick collaborative work being done with our local and federal public health and healthcare partners. Over the holiday weekend, this group of people quickly identified a possible risk, coordinated the patient's care, sent samples to the Centers for Disease Control and Prevention in Atlanta, and CDC tested them immediately. Now, together, we are implementing actions to ensure the public's health is protected. I'm thankful that the man who tested positive for this virus acted so quickly and sought treatment. His actions gave us a head start, and because of that, we were able to isolate him away from the public. As the governor said, all of this basically means our work, that this risk is low to the general public. Our first priority on Sunday when the patient sought treatment was to make sure that the patient got appropriate care and that samples were collected and sent to the CDC to determine if he was a case. During that time, we made sure that the patient was isolated from others. We activated our incident management team last night. Our number one priority is to complete the identification of all the patient's contacts, reach out to the contacts, and monitor their health. We also want to make sure that we are communicating information about the situation with the media and the public. Late this morning, 3 of our colleagues from the Centers for Disease Control and Prevention arrived to provide technical assistance and continue our close collaboration with the CDC experts in Atlanta and around the world. This is an excellent example of the collaboration and how the public health system needs to work together for the biosecurity of this country. And I just want to reiterate what the governor said, which is at this point, folks should go around and do their normal business. And as he said, if you have a cough or sneezes, cover those. Stay home if you're ill. If you have not yet gotten your flu shot, do that. In part, that's just good health this time of the year. But if somebody should have this infection, it helps us rule out other diseases of concern. So with that, I'm going to turn it over to Dr. Scott Lindquist, who is our infectious disease epidemiologist, to give us some more information, and that will follow with other folks from the local health department and Providence and the Centers for Disease Control. Scott. Yep.
Thank you. So one of the things we're doing for Washington State is to make sure every county is available and ready to evaluate patients that travel. So I know we talk a lot about airport screening, but that is only one piece of the system to really detect and take care of patients. So we have talked to every local health jurisdiction in the state. We've sent them guidance based on the experience at Snohomish on how to isolate, test, and what's the appropriate action for these patients. So I'm feeling good about this because we have had experience with other viruses that have primed the system, and we have the infrastructure there to do this. So that is something that is already in place as we speak right now. Now, having said that, there had to be the first case somewhere. And sorry, Dr. Spitters, it was in Snohomish. But I gotta say, this couldn't have gone smoother. And I think Dr. Spitters can give us some experience, because there's a lot of details in this this gentleman travels, who and how do you investigate who he was around? How do you even get him from his house to the hospital? What kind of conversation was the hospital, and what did you think when you got the phone call? I think those are all important things that we're working through for the rest of the country. So, Dr. Spitters, you want to give some detail on your?
Sure. So I'm Chris Spitters. I'm the interim health officer for the Snohomish Health District. And just to give you, from the local perspective, our involvement in this, once we learned about the case and worked with the state health department and CDC last night, the Snohomish Health District coordinated with the Snohomish County Emergency Medical System to safely transport the affected patient to Providence Regional Medical Center in Everett, where he was admitted to the hospital. And following our jointly developed infectious disease protocols, we requested that Providence aid in isolating and monitoring the patient, which they've been most gracious and generous in doing. As stated earlier, our perception is that the risk to the general public in Snohomish County and beyond is low with respect to this particular exposure. We're working with Providence Medical Center to ensure that the small number of healthcare workers and patients who may have been exposed are identified and monitored for follow-up. As Scott, you said, nobody wants to be the first in the nation with these types of problems, but these are the types of situations that public health and its partners train and prepare for, and because of this collaboration, everything has been going quite smoothly. So on that note, on behalf of the Snohomish Health District, I'd like to thank CDC, the Washington State Department of Health, Providence Regional Medical Center, and all of our partners locally in Snohomish County who have been helping us in responding to this situation. And with that, I'd like to turn it over to Dr. Cook from Providence Regional Medical Center.
Thanks, Chris, and good afternoon to everybody. I'm Jay Cook. I'm the Chief Medical Officer of Providence Regional Medical Center in Everett. Just a few remarks. Most has been covered by more eloquent speakers than I, but we at Providence Everett Medical Center are working closely with our colleagues at the CDC and the Washington Department of Health, as well as the Snohomish Health District, to care for a patient who tested positive over the weekend for the novel coronavirus. The patient is currently in satisfactory condition because the risk of human-to-human transmission is believed to be relatively low, but out of an abundance of caution, we have the patient being monitored in a special isolation unit at our campus. We anticipate that the patient will be monitored for at least 48 hours and can hopefully then be returned home and discharged from the hospital. We are contacting a small number of staff and patients who may have come in contact with the patient at one of our clinics. We're implementing a screening system in our electronic health record to identify patients at risk for this infection going forward. Again, I'd like to recognize the great collaboration and coordination and assistance we've had from all levels of this multi-layered response team, including the CDC, the State Department of Health, the Snohomish Health District, and our other local leaders. So with that, I would like to turn it over to Dr. Pillai, an official from the CDC, for his remarks. Thanks.
Thank you. I'll be very brief. I just first wanted to thank and commend the State Health Department, local health district, the healthcare workers, and emergency medical service workers that have been working tirelessly, and you see the fruits of their labor. I'm glad that the individual that's currently under care is doing well, and I think the strength of the public health system was really shown in the past 72 hours as this situation has evolved. As you heard, this is a novel, new viral infection, and we continue to learn more every day. As you've heard, this is something that we consider to be of low risk to the public at large, but we want to be vigilant, and we are very appreciative of the opportunity to be here with you all to support the state, the local health department, healthcare facilities as you continue your investigation and as you continue your care for this individual. With that, I'll stop and open the floor for questions. Thank you.
I'll take this, go ahead.
Hi, Carla Johnson from the Associated Press. Can you confirm that this patient lives alone and/or was traveling alone? And that might be reassuring to some.
Yes.
Chris, why don't you come up to the mic here?
The question was, does this individual live alone? And the answer to that is yes, he does live alone. He was traveling alone socially, but surrounded by others, and so that is part of the work that's being done to identify who those others in close proximity to him that would need follow-up education and monitoring. That's in process.
What can you say about why he was traveling to Central China?
He was visiting his original home and is a permanent resident here now, and was coming back home after a trip home.
So I know there wasn't a direct flight. Do you know where the connecting flight was coming to CPAC?
It's not confirmed yet, but we know it wasn't a direct flight from Wuhan to SeaTac.
Okay, so you don't know where the connecting flight.
We're not confirmed yet.
Okay, and it took him, so he wasn't feeling symptoms when he landed here on the 15th, but is it possible that he could have exposed it to people on flights earlier than that?
Yeah, so we do know he was not symptomatic on the flight, but as was stated earlier, this is a new virus, so we don't know when you're truly infectious. Like some viruses, you can be infectious a couple days before you show symptoms. We don't know that yet, so this is part of learning a new virus. I mean, we've known about this for about a month and a half, so it's a great question. You'd make a great epidemiologist, but we just don't know those details yet.
Scott, could you just, excuse me, just, if you can, excuse me, just talk about how the process is going to work to notify people on the plane and the like. Just tell them who's going to be doing what in that regard.
Right, so determining who was at risk of exposure is the first step. So is it 6 feet distance? Is it a flight? Is it when you're symptomatic? These are all details we're working out with CDC right now. So the Department of Global Migration and Quarantine will take care of the air flight here. Once he lands here, it's a state responsibility. So finding what his transport was from the airport to his home, talking and tracking down those folks who are at risk and monitoring them for 14 days. We know it takes, once you're exposed, this we do know, it takes up to 14 days to develop symptoms. So we'll,
Agency's going to do that.
yeah.
Are there certain areas specifically in Snohomish County? Because we've got people living there and they're reaching out to us.
Yeah, so it's going to be CDC DGMQ for airport issues. It's going to be the state assisting Snohomish and their disease investigators that do this for a living. This is not the first time they've had to do something like this. And they will reach out to the patient and any deemed exposures in Snohomish County.
And then finally, there's some reports that Harborview Medical Center is handing out masks to people displaying symptoms. Is that?
That does not sound correct to me, nor is it a recommendation from the state or CDC.
Could I add something to this too, on Snohomish County? We understand how people would be concerned about something that's new. This is human. This is probably healthy. I just want to say there's nowhere in Snohomish County that I would be reluctant to take my new granddaughter or my family members. This is a low risk. It appears to have a transmission vector that really should not prevent anyone from going anywhere in Snohomish County except maybe the isolation ward at the hospital. So we want people to continue to enjoy Snohomish County, and we think they will.
Following up to that question though about areas, can you tell us what clinic he visited for that initial healthcare?
Yeah, let me just finish up this one thing. What you're probably talking about is, so I'm still a clinician, if someone comes into my practice and they have respiratory symptoms, we ask them to put on a mask. Because it could be para-influenza, influenza, or other diseases. So that's probably what's being translated from Harborview. That is a common practice to put a mask on a patient who has respiratory symptoms, not specific to this one in particular.
How do you know that the risk of this spreading is low? It sounds pretty ominous with 6 deaths out of 300 known cases. And how many people have been contacted who may have been in contact with him since he got here and started exhibiting symptoms?
I can perhaps take the first part of that question, and then in terms of contact tracing, I would turn it over to our local colleagues. I think, to your point, this is a new virus. We're still learning more. But having said that, there are ongoing dialogues with the World Health Organization, the countries in which there have been cases, including China, the US CDC, and thus far, the patterns of transmission have either been related to an initial market where individuals were first being identified as having potentially acquired the infection, and then subsequent investigations that have looked at individuals that haven't had that market-related exposure. There haven't been sustained multiple generations of transmission. So again, there does seem to be some limited human-to-human transmission based on the data that we have to date. This is a rapidly evolving situation. We'll continue to learn more, but for now, based on the epidemiology that we've seen, we believe that this remains a low risk to the population at large.
Can you repeat your question again, please? I'm sorry, we skipped your
Thank
question,
you.
but go ahead.
In regards to what clinic did he originally visit for that first treatment? And can you mention any other specific spots he visited prior to isolation?
So we are working with the clinic that he visited to do a walkthrough and identify everywhere he was, and the clinicians involved with him. We know two definitely who have already been notified, but we're looking for other less obvious staff or patient contact. At this time, respectfully, we're not disclosing the name or the site of the clinic involved because we don't think that doing so would add to the strength of our work. But we are looking closely at that setting to make sure all staff and any patients who would have been exposed are identified, notified, and monitored. Other settings, you know, he did use a mode of transportation from the airport to home before he got sick, which was the next day. And other than that, we're still working with him on identifying any trips out of the household, and then we would follow those up as well.
What about his movement around the airport? I mean, I'm sure people wonder, should they be concerned just walking around the airport?
Well, I defer to you, Scott, I think, on that. You want to comment on that?
Yeah. I think this is exactly why we have the CDC here to say, what constitutes a real risk? Understanding that there's not a lot of knowledge about this. We know there has not been a lot of airport transmission of this disease to date. So it isn't an emergent issue, but this is exactly why we had 3 CDC colleagues come. Think about that. They're here today. They just gave us the diagnosis yesterday. So I'm sure you guys are jet lagged, sorry. And so that is one of the questions. It's a really good question about what constitutes an exposure. Does it constitute an exposure before you're even ill? And then how long should we monitor? So those things are all going to be worked out in the next day or two with the CDC, which, recognizing they may not even have the answers.
And Dr. Spitters, was that mode of transportation an Uber or a public mode of transportation, like a bus?
Was a group form of transportation. We're still working out who the actual company was, and then we'll identify the actual trip and notify the folks who were on that.
It was a group.
Yeah.
What can you say about where he was in China and what he was doing? Was he anywhere in addition to Wuhan?
I don't have any information beyond what you just stated. We've really been focusing on what's happened since he got back, so I can't tell you. I don't know.
Just as a follow-up question, so do you guys have information on which airport he departed out of just prior to CTAC? Can you provide us with that information?
We don't have it confirmed. We've got some mixed message on where that is from.
Sir?
So, yes, sir.
Thank you.
So we have asked for his ticket so we can verify where did you come from Wuhan to where, how long was that layover, what did you do there, and then what airlines did you bring here? So that we have not got confirmed yet. We have yet to get the ticket from the guy, and so we're still working on it.
And are you guys recommending any additional steps at our airport, even though we know there's not screening at CTAC? Any additional steps folks should be taking?
So earlier today, CDC announced, and these plans have been in place even over the weekend, that there's going to be funneling of individuals that are traveling from Wuhan or originated their trip from Wuhan to 5 U.S. Airports, LAX, LA, JFK, Chicago, Atlanta, and San Francisco. And that is, again, an additional step to help identify individuals that are coming from the area that current concern and perform additional screening as they come into that funneled 5 sets of airports. Keep in mind that entry screening is part of a layered approach of interventions that are done to help reduce the risk of potential disease importation. But I believe Dr. Lindquist said, you know, it's a matter of time. We live in a globally interconnected world, and what we've done here is we were able to have astute clinicians who were able to follow public health messaging, ensure appropriate testing was done. So entry screening is one part of a larger public health enterprise. We want clinicians to know what to look for. We want the public, with your help, to know what are the signs and symptoms to look for, where, you know, there may be areas of risk. And then the other part is even airports that don't have active screening, there is messaging occurring. So all of this is a interconnected puzzle, but entry screening is one component of it.
And it sounds like this spreads like cold and flu. Is that the case?
I think as coronaviruses, which this is a new novel 2019 coronavirus, is in the family of viruses that are similar to the common cold. Respiratory symptoms predominate in the cases that have been identified and reported to date. Having said that, we're still early in this outbreak, and the full set of symptoms remains to be completely elucidated.
I wanted to reiterate a point. At least I think the CDC's response in airports, at least in my mind, has been appropriate for protecting Washingtonians, because the airlines are going to funnel the traffic to these 5 airports, not SeaTac, and that's an important point. That's going to pick up, I don't know, maybe 99% of the folks coming from that region. And that's why I believe that this is an appropriate response, and I'm glad that we're making it.
I would just also add, I guess, so anybody who's traveled to this affected area, the point is to monitor yourself for symptoms if you've been in there the last few weeks. So looking for fever or cough or respiratory issues, much like this patient did. Monitored himself, realized something was perhaps wrong, and called his healthcare provider. And that's the other thing we would want a traveler who's concerned, is to call their healthcare provider first, tell them where you've traveled so that they can prepare appropriately for your arrival. So this is the monitoring of symptoms, much like what we will be asking and working with folks who might have had contact with this patient to do to monitor their symptoms. So that would be the other piece for travelers.
So did he, when he called?
This lady's been waiting to ask a question for a long time.
So what is the statistical modeling showing right now in terms of the actual number of cases around the world? Because there are different projections out there right now. So curious about that. And I'll just, a couple other questions. Is the genome deciphered at this point? And what are you finding there? What are you finding in terms of susceptibility to mutations that could make it more transmissible? And I just want to make sure I understood correctly. I think that you said there have not been multiple generations of transmission. How many have there been? And then one last question, just to get them all out there. Do you have concerns for any campaigns of disinformation? And what are you doing to prepare for that? Including, you know, foreign actors that could be involved in something like that.
So thank you. I might miss some, so I'll start with the one that I can easily answer. Sequencing. We do have sequencing available. China provided that. I believe it's been over a week now. The importance of that can't be understated. CDC scientists were able to use that sequence data to help develop the assay this past week that within less than 24 hours, we were able to have a diagnosis for this individual. So the importance of having the genetic material was critical, and that test, now CDC scientists are working with FDA partners and other partners at the federal government to be able to make sure that we can get this test out into the state health departments in the coming weeks. It'll take a little bit of time. Until then, testing should come back to CDC Atlanta. And I think this is a really good case in point of the timeliness of testing to help inform clinical decision making. One. Two, in terms of, I can't speak to campaigns of disinformation. What I can ask is that since you're here and you're hearing from the public health community of your state and CDC, that you're able to amplify some of these messages that you've heard today. The CDC website remains, I think, an authoritative site for up-to-date public health information. In terms of your first question, ma'am, I blanked on it.
How many generations of transmission, and what's the current estimation of global number of cases?
So I don't want to speak to modeling. I don't have that data. I would defer to what is currently available on WHO websites, what information may be on the CDC website that I just haven't seen today. In terms of modeling, as well as generations of cases, I think Dr. Lindquist made a good point. This virus, this is something that started in late December. We're saying there's an incubation period of 14 days. So the modeling is only informed by the number of cases that you have and some of the assumptions that go into the model based on the information that you've been able to collect from the investigation. So all of that is still, that's a long way of saying it's very early in this investigation. In terms of the multiple chains of transmission, what I would caveat it by saying that there hasn't been evidence of sustained human-to-human transmission. Maybe within a family, there has been cases of someone that's been in close proximity. We've heard a lot about what does close mean in the persons under investigation definition. That's considered within 6 feet or 2 meters of an individual for a sustained period of time, where you may be caring for someone, living with them, being in the same room for an extended period of time. So it's time and proximity. But that's a long way of saying there's a lot that we still need to learn. And as we get more information, domestically and internationally, we'll be able to answer those questions. Thank you.
Last question, please.
Yeah, let me add something to that. I think this is a moment we understand how important it is for us to have good science and good scientists, and our federal government makes decisions based on science, not politics or ideology. And I think this is a moment to be appreciative of the CDC for making decisions based on science and transparency with the public. You see in real time the information we're sharing with the public. And I think that's important to say because, unfortunately, we've seen some cases where people have suppressed science in our federal government, and we want to stand arm in arm with the CDC to continue to make good scientific health decisions. We believe if these folks have the ability to do that, they will do that, and that's extremely important to work in partnership with them. We look forward to that.
What should people be looking for in terms of, how do they know if they just have a common flu or if they have something, if they have the coronavirus?
Yeah, that's the trick to this, is because this novel coronavirus can look like the flu. It can look like a common cold. What's really in the case definition, which is a definition we use, you have to have exposure to the known site of transmission. So if you were to say, look, I was in the animal market in Wuhan, China a week ago, and now I have a runny nose and a bad cough, perfect. But just anyone who has cold and cough symptoms that has not traveled, at this point, it is not a good indication, nor we would consult with CDC, is this a person to test? And the answer would be no, because you don't have the epidemiologic risk factor. The other caveat is if you've been exposed to someone with confirmed novel coronavirus.
Did this patient have a pre-existing condition that made them more susceptible to this, or were they perfectly healthy before this happened? And what symptoms did they show? Are you able to tell us that?
The symptoms were as described.
Thank you.
The symptoms in the individual affected were as described: fever and cough, and no known underlying medical conditions that would predispose to a bad outcome.
We're relieved to hear that he's in satisfactory condition. Can any of you tell us how he's doing in terms of his spirits? Is there any information you can provide us in that regard?
Yeah, I can tell you that he has been, he asked for a phone to call his family. He's resting comfortably and appears really clinically stable. Obviously monitoring it very carefully because, as you've noticed, noted there have been people who have died from this, but he's doing well so far.
Are his parents in China by chance, or?
I don't know that.
And you're confident it's safe to send him home in 48 hours or whatever time frame, or do you have?
I think that remains to be seen. I mean, I think that as we learn more about his particular case and about this virus in general, that will be a call that we'll definitely make in partnership with the Department of Health and CDC.
Not decided yet.
Correct.
How are the airlines and the government relating to people who are traveling and the disruption in their plans and having to rebook? Is this expense coming from families, or is it compensation, or how is that happening?
I certainly do not know the answer to that question, but I do know when you're dealing with a virus with some uncertainty associated with it, these are clearly the right decisions for our communities and our families. That will be worked out, I hope, to everybody's benefit, but our commitment needs to be to the general public, and we're exercising that today. And, be well. We will, I know, continue to share information as it becomes available. Thank you, and be safe, and wash your hands. Thanks.